Hello, welcome to another Community Connections. Thank you for joining us today. It is Thursday, September 15th, and we have another amazing session for you and with another amazing guest. So again, thanks for joining us. My name is Jeremy Capone. I am the wellness chef for the Cancer Rehabilitation and Survivorship Program and your Community Connections Program Coordinator. So just to give you a little heads up of today's agenda, we are going to start off with a wonderful presentation from Melanoma Canada. And then our cooking and nutrition demonstration will begin at around 12 p.m. With myself and our amazing registered dietitian, Daniela Fiorini. So definitely stay tuned for our cooking class that will follow this presentation. To start things off, I would love to welcome Abbie Wiggin. So Abbie works at Melanoma Canada as the manager of community programs and resources. In her role, she connects with melanoma and skin cancer patients, caregivers, and survivors to provide counseling services and healthcare navigation. Abbie is joining us to talk about some of the amazing resources and programs offered by Melanoma Canada. And I'll mention as well, for more information, you can check out their website, melanomacanada.ca. So without further ado, I would like to throw it over to Abbie.
Hello, everyone. My name is Abbie, and I'm here on behalf of Melanoma Canada. I would like to start with thanking ELLICSR Kitchen for having us today to take part in Community Connections. So I'm honored to be here today to talk to you about Melanoma Canada, the community programs and support services we provide, and how we can help you through your melanoma or skin cancer journey. So I work at Melanoma Canada as our patient care specialist and the manager of our community programs and resources. So within my role, I provide patients, caregivers, and survivors with support, assistance navigating the healthcare system, and act as an advocate and guide to our patient community. I also respond to all inquiries to our online chat. I answer our support emails and phone calls, facilitate one-on-one support through our cancer coaching program, and I facilitate our monthly support groups as well. So I'll start with talking about why Melanoma Canada even exists. Well, to start with, non-melanoma skin cancers are the most common cancer diagnosed worldwide, or more common than breast, prostate, lung, and colon cancers combined. Melanoma is the deadliest type of skin cancer, and diagnoses are on the rise in Canada, accounting for 4 deaths per day across the whole country. It's one of the fastest growing cancers worldwide, and in Canada alone, the incidence rates of melanoma have more than tripled in the last 30 years. The good news, though, is that when it's detected early, survival rates for melanoma and skin cancer remain high. Additionally, since the leading cause of melanoma is the overexposure to UV radiation, there is a lot we can do to prevent it. So one of our biggest missions as an organization is to promote the early detection and preventative measures that are needed. So who is Melanoma Canada? We are a national organization dedicated to advocating for and supporting Canadians living with and who are impacted by melanoma and skin cancer. So we focus on providing helpful resources, education, and psychosocial support. The organization was previously known as Melanoma Network of Canada and was founded in 2009 by Annette, a patient and 3-time survivor of melanoma. And the organization was founded to respond to the need for patients to have a nationally based organization that was really focused on coordinating educational and prevention efforts and assisting in efforts to target funding for melanoma research in the country as well. So this year, we're very pleased to launch our new name, Melanoma Canada, with a renewed commitment and focus on providing that crucial education, our prevention programs, and support services to our community as well. And our goal is to continue to unite the voice of the melanoma and skin cancer community by advocating for that improved access to care and access to improved treatment options as well. As I've said, we're really on a mission to support melanoma and skin cancer patients, caregivers, and medical professionals through current and coordinated information and services. We're on a mission to educate Canadians as much as we can on melanoma and skin cancer. We like to talk about what you can do to prevent melanoma, how you can facilitate early detection at home, and the treatment options that are available as well. And we're really on a mission to be the united voice of the melanoma and skin cancer community and continue our advocacy efforts for early detection, timely diagnosis, and the effective treatment options. And all of this work and all of these missions are really with our one vision in mind, and that vision is a world with zero melanoma and skin cancer related deaths. And we really place value in being supportive, and that's being supportive to every person affected by melanoma and skin cancer at any stage of their journey, any stage of the disease. Placing value in being passionate about access to credible information and effective treatment, and placing value in being a trusted and reliable resource for the public and for industry partners as well. So now I will be discussing the support services that Melanoma Canada provides patients, caregivers, and survivors. So our cancer coaching support service provides patients with one-on-one support at any stage of disease, any stage of your journey. The focus of the cancer coaching sessions are really determined by each individual, and my role there is to facilitate any desired areas for change, by creating an actionable, self-manageable plan that can address those areas of concern and those areas of identified need. The program can help with the emotional, physical, and practical aspects that can present during cancer diagnosis, treatment, and management. And ultimately, the goals of the program are to help address individual concerns, to make you feel heard and well supported, and to provide the tools and coping strategies to minimize anxiety and uncertainty that comes with coping with cancer. If you're interested in learning more about the cancer coaching program, you can scan the QR code on the screen, visit our website as well, and that has information on how to contact me to make an appointment. And we also provide support over phone and email by answering general questions you may have, providing referrals to information and resources, assisting with reviewing a diagnosis or treatment options, clinical trial information, and helping to make sense of complex terminology and medical information. We do not give medical advice, but we will help try to help you navigate your diagnosis and the medical system wherever possible. So we're available Monday to Friday, 9 to 5 Eastern time. So you can contact me at the information on the screen there. So we also have our melanoma patient support groups. Our monthly support group is the first Wednesday of every month on Zoom, so you can join no matter where you live in the country. And our groups focus on fostering a safe and welcoming space for patients of all stages, diagnoses, treatment plans. And the goal is really to join and share information, understanding, challenges, questions, tips you may have. And the groups really provide patients with a lot of encouragement, connection, and support from others. And we also have our peer-to-peer support program. So our peer support program connects patients with a peer who shared a similar path and can really provide immeasurable support. So our peer volunteers are interviewed before joining the program, and then they go through a certified training process before they're eligible to be matched with a peer. And our peer mentors are assigned, to the best of my ability, with a peer who has a similar geographic location, diagnosis, or life situation. And the program is offered by phone or email and can connect patients anywhere in Canada. And the program really allows for peers to share stories, to act as a supportive mentor, and create a special connection that can relieve some of the stress, worries, and concerns that come from living with a melanoma or skin cancer diagnosis. And I really find that the quote on the screen is really insightful into the benefits of the program. And it demonstrates how the support from the program is quite unique to the support that a patient can receive from other sources. So again, if you are interested in learning more, you can scan the QR code and it'll take you to our website. So we also have a really positive online community. It has we provide a wide range of online resources for you to access, including private Facebook groups that are monitored by me and available depending on your diagnosis. So we have a group for basal cell carcinoma, squamous cell carcinoma, uveal melanoma. So you can really find other people who have a very similar diagnosis to you. We have a private live online chat through our website where you can connect with me anonymously to ask questions. Our patient stories are a popular part of our website as well. They provide insight into other patients' journeys and can be a really valuable source of connection, inspiration, and community as well. And you can also watch recordings of our past melanoma information sessions and patient perspectives in our online video library. And lastly, you can sign up for our newsletter. We have really great information on there, also on our melanoma and skin cancer blog. So our patient information sessions are a series of presentations featuring guest oncologists, dermatologists, surgeons, psychologists, and more who present on the latest in melanoma treatment and updates. And these sessions really provide patients and caregivers with the opportunity to ask questions to specialists. You can connect with other patients and to receive really current, reliable, and trusted information from people who are leaders in this field. Our next patient information session is in October, so stay tuned for that, and you can scan the QR code on the screen to sign up to be notified about that as well. So we also have our melanoma and skin cancer publications. They're leading edge publications that are written with the help of specialists in oncology and are very helpful for patients, caregivers, and healthcare professionals. And depending on what you're looking for, we have a comprehensive list of resources from our melanoma, what you need to know, to helping you understand squamous cell carcinoma or basal cell carcinoma. We have a resource on managing lymphedema, photosensitivity, information on adjuvant therapies, and our guide to uveal melanoma as well. And our publications are provided free of charge and provide complex medical information in really easily understandable terms. And we also include a lot of additional resources, such as questions you should consider asking your doctor, helpful suggestions that we might have. And these all really help people diagnosed to learn more about their diagnosis and available treatment options. And we really believe that education is incredibly important in making informed decisions and being an active participant in your care and treatment. If you're interested in downloading a copy of any of our resources, you can scan the QR code, which will take you to the website where you can download them to your computer, or feel free to contact me and I can have a physical copy sent to you as well. So, caring for yourself through nutrition and healthy habits is an essential part of cancer care, and that's why I'm sure a lot of you are here today. Getting all of the nutrients your body needs can help you to maintain your weight and strength, stay active, and support your recovery. And because we know the importance of this, we have a range of resources on our website to help guide patients and caregivers towards making choices that will help you feel your best. So we have content relating to staying well nourished and hydrated, managing fatigue, tips on how to ensure you're receiving enough vitamin D, how to manage diarrhea during treatment, and ways to stay active. So in terms of staying well nourished and hydrated, there's a few things to keep in mind. One would be to fuel up at regular intervals to maintain your energy levels and prevent muscle loss, to stay hydrated to prevent fatigue, to keep things simple and focus on key aspects of your meal like protein, whole grains, and vegetables, and plan for convenience and give yourself permission to take shortcuts to allow you to meet your nutritional needs and save energy. And our website has a range of sample meal plans for you when you might be struggling with diarrhea or nausea. We have homemade electrolyte recipes, nutritious snack ideas that don't require cooking, and tips on how to make food preparation a little bit easier. So you can scan the QR code and it'll take you to that section of our website, and you can also watch recordings of our previous appearances in the ELLICSR kitchen as well. So as I said previously, melanoma and skin cancer are largely preventable cancers that have a high survival rate if detected early. So part of our mission as an organization is to spread this awareness and ensure that people across Canada have the most up-to-date and detailed information. So we have a variety of public health initiatives, including dispelling common sun safety myths in the media, advocating for the ban of tanning services, promoting the importance of winter sun safety, which is often forgotten about, and answering common questions about sunscreen. In 2014, we launched the Screen Me Sunaware Camp program to protect children and teens from skin cancer by supporting Ontario summer camp owners and directors to implement sun safety best practices for all staff and campers. And we also have our 3 Ways to Block the Raise program, initiative as well, which is a reminder of the 3 main ways to protect yourself: to number 1, apply sunscreen; number 2, to seek shade between the hours of 11 a.m. and 3 p.m. when the UV index is at its highest; and 3, to wear SPF clothing. And as I said previously, when spotted early, melanoma has a cure rate of about 85%. So we know the importance of early detection. And through initiatives such as our monthly skin check reminders, our guided videos on how to perform a skin cancer self-exam, and our ABCDE detection cards, we aim to encourage early detection by educating Canadians on how to spot melanoma. So if you're interested, you can scan the QR code to sign up for our skin check reminders, which are sent monthly. So we place incredible value in being a source of credible information and a reliable resource for our industry partners. So because of this, we launched our first physician education program in 2021, providing primary care providers with the teachings to facilitate early diagnosis and treatment of melanoma to improve patient outcomes. Our course teaches physicians how to triage skin lesions more accurately and at an earlier stage, with a focus on recognizing suspicious skin lesions and selecting which biopsy would be most appropriate. So we develop these courses as we understand the challenges many Canadians face in accessing a dermatologist, and the ways in which geographical location can exacerbate this challenge. For a lot of people, their family physician is the person that they're seeing the most, their primary care provider. So we really wanted to equip these physicians with the knowledge and the resources to detect melanoma. And because of the success of our first program, we just launched 2 brand new courses with a focus on the presentation and detection of melanoma in patients with skin of color who often face late-stage diagnosis and poorer health outcomes. So as the leading national organization dedicated to advocating for Canadians living with melanoma and skin cancer, we place a lot of importance on our advocacy efforts and ensuring that Canadians have improved education, treatments, and access. So we do so by providing submissions for new drug therapy and advocating on behalf of our patient community to the Pan-Canadian Oncology Drug Review to ensure that the highest quality treatment options are available. We will be launching our new website very soon, and with the launch of our new website, we'll have a brand new clinical trial finder that will allow patients to search for clinical trials depending on their diagnosis to assess their eligibility and potentially take part. And as a leading patient advocacy group, we launched a major public awareness campaign this year, which was focused on highlighting the scale of unidentified melanomas during the pandemic. So our survey of over 700 dermatologists suggested that a third of professional self-exams were missed due to lockdowns. So our goal with this advocacy work was to really promote the habit of conducting monthly skin self-examinations.
10 years ago, I would have died.
When you're a teenager, you just feel like you're invincible.
Especially for my demographic, I always assumed that it's never gonna happen to me.
I was expecting to get into retirement.
I was getting out of the shower one morning and I felt this weird lump in my leg.
So many of the doctors dismissed it, said it was nothing.
2 weeks later, I find out that it is indeed melanoma, malignant melanoma.
And he diagnoses me with stage 3B melanoma.
You don't expect at 27 years old that you're going to get a deadly form of skin cancer.
My family was immediately thrust into the world of cancer.
I remember it was a very long ride home, and the only thing I could think of was how I would tell my wife, Monique.
It's just my husband, my son, and I. Leaving them behind is one of the most shocking, devastating things.
Naomi is the reason why I made it through that first year. As a partner, I changed a lot in that time. And thank goodness Jordan didn't, because he was my rock the whole time. They were my team.
It definitely rocks your world after you're diagnosed as a husband and a father. I always told my wife that my most exciting days would be to watch my kids get married, have time with the grandkids, to watch them graduate, just thinking about those moments that I may or may not get in the future. Prior to getting diagnosed with cancer, I was a recreational runner where I would do 10Ks and half marathons. Monique said maybe this would be a phenomenal way to just rebuild yourself and tell cancer that, you know what, nothing can hold you down. 10 years ago, I would have died. But I'm still here.
I'm still here.
And I'm still here.
I'm still here.
And I'm still here. And it's not going to stop me from watching her grow up.
It's not going to stop me from pushing me beyond my limits.
The landscape of melanoma has changed so much in the past, even the past year.
I owe my life to the fact that now there's better technologies available, like immunotherapy.
It helped me sleep better at night afterwards, knowing that my future wouldn't be determined by a flip of a coin.
I'm so hopeful that it almost makes me not as scared anymore.
So as I've discussed, early detection of melanoma and skin cancer is imperative. And I want to take this moment to remind you to perform monthly skin checks and to visit your dermatologist annually or with any concerns. And to also sign up for our skin check reminders as well. So we have some really exciting events coming up, including patient information session in October, which will be focusing on melanoma treatment updates with a leading melanoma oncologist. Our 7 Summit Snowshoe Challenge will be in the new year to promote awareness and the importance of winter sun safety. We have our annual Strides for Melanoma 5K walk in the spring, and we really encourage you to participate. And you can stay up to date on all of our upcoming events on our website and social media channels as well, which are at Melanoma Network. And we also encourage you to get involved with our organization, whether that's as a volunteer for our fundraising events. If you are interested in being a peer volunteer, you can contact me to discuss that a little bit more, whether you're interested in hosting a Strides walk in your local community, or if you're interested in making a donation to help us reach our ultimate goal of 0 melanoma deaths. So thank you so much for having us today. Please feel free to contact us on the number on the screen. That's my extension there, or you can email support@melanomanetwork.ca. And we really hope you enjoy the cooking demonstration.
Thank you again to the Melanoma Network, or sorry, Melanoma Canada, and Abbie for the wonderful presentation. Thank you for sharing all those resources. Again, as Abbie mentioned in the presentation, for more information, you can check out melanomacanada.ca. They're also pretty active on all their socials as well, so definitely check them out. Also, thanks for sharing that very powerful, impactful video. It was wonderful. So really appreciate working with Melanoma Canada. Again, it's always a pleasure to be able to collaborate. And we are going to be featuring some of the nutrition recommendations with Daniela and myself in our cooking and nutrition segment coming up. And I know that Abbie touched on it briefly in her presentation. We're going to dive into some of those recommendations to help manage some of the side effects of melanoma cancer and its treatment. And so stick around. We're going to be cooking 3 delicious recipes starting at 12 o'clock. So we're going to take a short break now. But again, thanks for joining us for our community partner information session. We will be back for another wonderful class next month. So it's on the 3rd Thursday, as I'm frantically looking at the date, 3rd, which is the 20th of October. So 20th of October, we will be back at 11 a.m. Eastern Time. We have another great guest joining us. So what you can do is, if you haven't already, subscribe to our channel and click the notification bell, and it'll give you a heads up when we have our upcoming class planned. So it sort of gives you a reminder that way. And you can check out all of our socials. So we'll be posting any information about any upcoming community connections, classes, and events on our at PM Cancer Rehab Twitter and Instagram, and also on our ELLICSR Kitchen socials, and that's at ELLICSR Kitchen. And we post pretty regularly on Twitter and Instagram. So you can check those out for any upcoming classes and some of the guests that we'll be featuring. So thank you again to Melanoma Canada. Thank you again to Abbie for joining us. Stick around. We'll be jumping back shortly, 12 o'clock, for our cooking and nutrition demonstration. Thanks, everyone.